Good afternoon, all. Myself, Dr. LEKSHMI VENUGOPAL. Today, I'll be discussing the topic permanent maxillary and mandibular canines and premolars. Canines are the long and stable teeth, and there are two maxillary and two mandibular canines placed at the corner of the mouth, hence called cornerstones of dentition. A single pointed cusp present in the canines, hence called cuspids. Canine has got a main role in the mastication as tearing. Moving on to the first tooth about the chronology of permanent maxillary canine. The first evidence of calcification starts at the age of 4 to 5 months. Enamel completed the age of 6 to 7 years. Eruption completed at the age of 11 to 12 years and root completion at the age of 13 to 15 years. About the morphology of the permanent maxillary canine, labial aspect, it is outline is roughly pentagonal, and here you can appreciate the shape, that is pentagonal shape, and the crown is narrower mesiodistally compared to that of central incisor. Here it is the mesiodistal dimension, and this is narrower compared to that of central incisor, and this tooth has got two cuspal slopes, mesial slope and the distal slope, and here this mesial slope is shorter compared to the distal slope. And about the surface, and this labial surface is smooth and bulky because of this prominent labial ridge, that is a ridge extending from the cusp tip to the cervical region. About the surface, labial surface is convex in all directions, and the mesial outline, this is a mesial outline, and it is convex, and it has got a rounded mesio-incisal angle. And whereas the distal outline, here you can appreciate that this distal outline is more concave and it has got more rounded disto-incisal angle. Moving on to the lingual aspect, the crown and root are narrower lingually for this particular tooth, and there is a well developed and large cingulum in the lingual aspect, and there is a lingual ridge that is extending from the cusp tip to cervical area in the lingual aspect. This lingual ridge divides the lingual fossa, that is a fossa present in the lingual aspect, and this ridge divides the lingual fossa into two, that is a mesial lingual fossa and distal lingual fossa, and there's a cervical line and it is curving towards the apical area of the root. About the mesial aspect, from the mesial aspect, permanent maxillary canine is the widest anterior tooth labiolingually. Here you can appreciate that this is the widest tooth in the among the anteriors, and the cervical line is curved towards the incisal region. This curvature is towards the incisal region, and the contact area is seen near the junction of middle and incisal third. Contact area, mesial contact area is seen near the junction of middle and incisal third. About the distal aspect, all other features, that is the distal surface is very similar to mesial surface. Some differences are cervical line exhibits less curvature compared to the mesial aspect, and contact area is seen at the middle third here, whereas contact area in the mesial aspect is seen at the junction of middle and incisal third. Lastly, the incisal aspect, that is the shape of the incisal aspect is diamond shape, and the cusp tip is labial to the center of the crown, labiolingually, and mesial to the center mesiodistally. The center of the cusp tip is labial to the center of crown, labiolingually, and mesial to the center mesiodistally. Root, it has got a single root, and the mesial and distal surfaces of the root have developmental depressions, and the labial and lingual surfaces of root are convex in shape, and root tapers to a sharp or slightly blunted apex. That's all about the permanent maxillary canine. Now we'll move on to the next tooth, that is permanent mandibular canine. About the chronology, first evidence of calcification, the age of 4 to 5 months, enamel completion at the age of 6 to 7 years, eruption 9 to 10 years, and root completion at the age of 12 to 14 years. Moving on to the labial aspect, the mandibular canines are narrower. This is a mesiodistal measurement, and mandibular canines are always narrower mesiodistally. And the mesial outline of the crown is straight and it is in line with the mesial outline of the root. That is the mesial outline here. It is straight and it is in line with the mesial outline of the root. Here is the mesial outline of the root and it is in line with the mesial outline of the crown. And distal outline, it is more convex. Here you can appreciate that distal outline is convex and it has got a rounded disto-incisal angle, and the mesial cusp ridge is smaller than distal cusp ridge. Here this is a mesial cusp ridge. This is straight and this is smaller compared to the distal cusp ridge. Cingulum, compared to the maxillary canine, the cingulum is less prominent and it has got less distinct marginal ridges. Mesial and distal aspects, these aspects are almost similar in all aspects. Slight differences are there, that is about the cervical line, and the curvature of the cervical line is seen more on the mesial aspect than the distal aspect. Here from the picture you can appreciate that this is more curved and this is less curved. And the contact area of the mesial aspect is seen at the incisal third, and here it is more seen more at a higher side, that is more towards the incisal third region. Incisal aspect, here the cusp tip is inclined in a lingual direction. See here the cusp tip is more inclined in the lingual side, and root about the root is shorter than the root of maxillary canine, and developmental depressions are more pronounced in the mandibular canine. Moving on to the next most important tooth, that is maxillary first premolar. Here you will get an essay from this chapter, so you should be well prepared for that topic. Maxillary premolars, as you all know, they are called bicuspids and they have two cusps, that is one is buccal and one is lingual. Four maxillary premolars present in your jaw and two each on each side. What are the main functions of maxillary premolars? That is, first one, they assist in shearing and cutting, and it supports the corners of the mouth. About the chronology, the first evidence of calcification start at the age of 1.5 to 3/4 years. Enamel completed at the age of 5 to 6 years. Eruption 10 to 11 years, and root completion at the age of 12 to 13 years. It has got four surfaces and one occlusal aspect, that is buccal, lingual, mesial, distal and occlusal. And 80% of this permanent maxillary premolar has two roots. Moving on to the buccal aspect. First, the outline of the tooth, that is trapezoidal in shape. Here you can appreciate the shape, trapezoidal, and this shorter side is cervical compared to the occlusal side. Here these two are the sides of the trapezium, and here this is the shorter side, which means cervical side is the shorter one compared to the occlusal side. And the cervical outline, that is the crown, shows a little curvature at the cervical line. Here's less curvature at the cervical line, and the crest of curvature of the cervical line is near the center of the root. Crest of curvature means the maximum curvature is called the crest of curvature, that is seen near the center of the root. Here the cervical line is maximum curved at the center of the root. About the surface anatomy, the surface anatomy of the maxillary first premolar can be explained by the elevations and the depressions present. One elevation present in the particular tooth is the buccal ridge, that is the ridge extending from cervical line to the cusp tip, and the depressions, they are the two developmental grooves. They are present mesial and distal to the buccal ridge. This is the buccal ridge, and these are the developmental grooves present mesial and distal to the buccal ridge. And the root, the buccal root is similar to that of the canine but shorter in length. This root is similar to that of canine but shorter in length, and this buccal root always superimposes on the palatal root. As I told you, there are two roots for the maxillary first premolar. Since this root superimposes on the palatal root, we cannot appreciate the palatal root from the buccal aspect. About the lingual aspect, lingual cusp is actually shorter than the buccal cusp by 1 mm, and the mesial and distal slopes of the lingual cusp have right angle. See, and this has got a less developed lingual ridge compared to the buccal ridge, and this has got a lingual convergence too. See, here is the lingual convergence. Since the lingual convergence present, we can appreciate the part of the buccal aspect from lingual aspect. Cervical line is slightly convex or even straight, and root, a portion of the buccal root. Here you can appreciate a portion of the buccal root from the lingual aspect. Moving on to the mesial aspect, here also the outline, geometrical outline, it is trapezoidal in shape. You can appreciate this. This is roughly trapezoidal in shape, and the buccal outline. This is the buccal cusp, and here it is the buccal outline. It is convex till the buccal cusp tip with the maximum. Here you can see this is convex in shape, and the maximum convexity is seen at the cervical third region. Here is the maximum convexity, and the lingual outline, here it is also convex, and the maximum convexity is seen at the center of the tooth. About the lingual cusp, it is shorter than the buccal cusp. Here you can see this is the lingual cusp. It is shorter compared to the buccal cusp. And the mesial marginal ridge, this is the mesial marginal ridge that is present at the junction of occlusal and middle thirds. And mesial contact area is present at the middle third. Here it is the middle third, mesial contact area. And about the mesial and developmental groove, that is a groove that is continuous with the central groove, and it will cross the mesial marginal ridge and terminating at a shorter distance. Here you can appreciate the mesial developmental groove that is continuous with the central groove extending to a shorter distance crossing the mesial marginal ridge, and mesial developmental depression that is seen above the contact area, and it is continued to the root surface. Here a developmental depression present, and this depression is also called as canine fossa. About the root, the buccal cusp tip is in line with the center of the buccal root. See here, this is a cusp tip, and this line with the center of the buccal root, and lingual cusp tip is in line with the lingual border of the lingual root. That is, buccal cusp tip is in line with the center of the buccal root, whereas lingual cusp tip is in line with the outline or lingual border of the lingual root. And the bifurcation of the root present at the middle of the root length. Bifurcation is seen at the middle of the root length. About the distal aspect, compared to that of mesial aspect, there's no developmental groove and no developmental depression seen. And contact area is more broader. The size of the contact area is more broader compared to the mesial side, and cervical line is less curved or straight. And the bifurcation of root is present at the apical third, whereas the other side, mesial side, the bifurcation is present at the middle third. Here it is seen at the apical third. About the occlusal aspect, the outline of the maxillary first premolar is hexagonal because it has got 6 sides, that is mesiobuccal, distobuccal, mesial, distal, mesiolingual and distolingual. And the buccolingual measurement, that is here, this is the buccolingual measurement, it is more compared to the mesiodistal dimension. Here this is more compared to the this measurement. Occlusal aspect shows slight convergence to the palatal aspect, that you will clearly appreciate in this picture. This is converging towards the palatal side. Here it is wider and here it is less wider. Ridges. There are certain ridges present in the occlusal aspect of this particular tooth. One is triangular ridge. And triangular ridges are ridges extending from the cusp tip to the center of occlusal aspect. Here these are the triangular ridges, and there are two types of triangular ridges, that is buccal and lingual. And the buccal triangular ridge is more prominent compared to that of lingual triangular ridge. And transverse ridge is the triangular ridge of buccal cusp meets the triangular ridge of the lingual cusp to form a transverse ridge. Here the whole ridge is called transverse ridge. The triangular ridge of buccal cusp meets the triangular ridge of the lingual cusp to form a transverse ridge. Next ridge is the mesial marginal ridge. That is, mesial marginal ridge forms the mesial boundary of the occlusal aspect, whereas the distal marginal ridge is located at the distal margin of the occlusal aspect. Another important feature you can appreciate in the occlusal aspect is groove, presence of grooves. One is central developmental groove. This is a main developmental groove, and this is extending in a mesial-distal direction from here to here, from mesial triangular fossa to distal triangular fossa. Here this triangular part is the triangular fossa, and one is mesial triangular fossa and the other is distal triangular fossa. And the groove extending from this mesial triangular fossa to the distal triangular fossa is nothing but central developmental groove. Another grooves are the mesiobuccal and distobuccal developmental grooves. These are two collateral developmental grooves. They are extending from the mesial and distal pit in a buccal direction. Next is the most important distinguishing feature in the maxillary first premolar, that is the presence of the mesial marginal developmental groove, that we have already seen in the mesial aspect of the same tooth. And this groove, starting as an extension from this central groove, runs in a mesial direction across the mesial marginal ridge and ends on the mesial surface. Also, there are few number of supplementary grooves present. Next are fossa and pits. Mesial triangular fossa, like any other tooth, this mesial triangular fossa present as a triangular depression near mesial marginal ridge, and the distal triangular fossa located near distal marginal ridge. And the mesial and distal pits are present in triangular fossae where the grooves converge. These mesial and distal pits present in the triangular fossae where the grooves converge. Moving on to the next one, that is permanent maxillary second premolar. About the chronology, first evidence of calcification seen at the age group of 2 to 2.25 years, enamel completed at the age group of 6 to 7 years, eruption at the age of 10 to 12 years, and root completion at the age of 12 to 14 years. About the surfaces, just like the maxillary first premolar, it has got four surfaces, and that is buccal, lingual, mesial, distal, and one occlusal aspect. And 85% of the maxillary second premolar has one root. Here we study this particular tooth by seeing differences from the maxillary first premolar. That means the maxillary first premolar, it has got a larger, longer and sharper buccal cusp, whereas maxillary second premolar has got smaller, shorter and less sharp buccal cusp. Mesial slope of the buccal cusp is longer than distal slope in maxillary first premolar, whereas a distal slope of buccal cusp is longer than mesial slope in second premolar. The prominent buccal ridge seen in maxillary first premolar, whereas in second premolar there's a less prominent buccal ridge. And cervical convergence of crown on the buccal cusp is more on maxillary first, whereas less on maxillary second premolar. And the crown, it is narrower on the lingual aspect in maxillary first, whereas lingual taperance or lingual convergence is less seen in maxillary second premolar. And the buccal cusp here, yeah, that means in maxillary first premolar it is longer than the lingual cusp, whereas in maxillary second premolar, main difference is both the buccal and lingual cusp are of nearly same size. And mesial developmental groove, that is the most important distinguishing feature in the maxillary first premolar, that is a groove crossing the marginal ridge to the mesial surface, and here in maxillary second premolar there is no such groove present. And there's a mesial developmental depression on the mesial surface of crown and root seen in maxillary first premolar, whereas no such depression seen on the mesial surface in maxillary second premolar. And the cusps are relatively closer and occlusal table is narrower in maxillary first premolar, whereas the cusps are spread apart and occlusal table is wider in maxillary second premolar. Occlusal aspect is asymmetrical and it is hexagonal in shape in maxillary first premolar, whereas here, that is in maxillary second premolar, it is symmetrical and it is of oval shape. And central groove is longer in maxillary first premolar, whereas in shorter in maxillary second premolar. Supplementary grooves are few in number in maxillary first premolar, whereas there are many supplementary grooves making occlusal aspect irregular or wrinkled in appearance in the case of maxillary second premolar. First premolar usually has two roots. In most of the cases, maxillary first premolar usually has two roots, whereas in maxillary second premolar, it has got only one root. Now we'll move on to the mandibular premolars, that will look on to the most important features of mandibular premolars, that is the occlusal aspects. About the occlusal aspect, the main outline of the occlusal aspect, that is diamond or round shape. The occlusal surface tapers lingually. That means the lingual side is shorter compared to the buccal side. Here you can appreciate this. This side is shorter compared to the buccal side, and the buccal cusp has a triangular ridge. Triangular ridge is the ridge extending from the cusp tip to the central groove, and this is large compared to the triangular ridge on the lingual cusp. And the buccal and lingual triangular ridges are connected by transverse ridge, just as in the case of maxillary premolars. These triangular ridges are connected by transverse ridge. Moving on to the occlusal aspect of mandibular second premolar. The occlusal aspect. There are two types of occlusal aspects seen in the mandibular second premolar. One is the 3 cusp type and the other is 2 cusp type. And the geometrical outline of 3 cusp type is square and it has got 1 buccal cusp and 2 lingual cusp. The arrangement of the cusp according to the size is buccal, mesolingual and the distolingual, being buccal cusp being the largest one and the distolingual being the smallest one. Every cusp has a triangular ridge just as all other cusps. These also has triangular ridge and there is a Y-shaped developmental groove separating the cusp. There is a central fossa here and also mesial and distal triangular fossa present just like the maxillary premolars, and it has got a central pit and the mesial and distal marginal ridges also present, and this is the Y-shaped groove. See here, this is the Y-shaped groove separating the cusp. Coming to the 2 cusp type, the geometrical outline in the 2 cusp type is round and there is lingual convergence seen here. Here, this side is shorter compared to the buccal side and there is 1 buccal and 1 lingual cusp and there may be a transverse ridge present. In 2 cusp type, the central developmental groove may be H or U shaped. This surface has got many supplemental grooves and the mesial and distal fossae found are round in shape compared to that of triangular shape in other teeth. Here the mesial and distal fossae are round in shape. This is all about today's topic. Thank you.